Welcome dear students. While studying about the complications of suppurative otitis media, this is the last complication in this series, and in this video we are going to discuss about otitic hydrocephalus. So what is otitic hydrocephalus? It is characterized by increased intracranial pressure without enlargement or dilatation of the ventricles, and is usually secondary to lateral sinus thrombophlebitis. It occurs as a complication of suppurative otitis media or as a complication of lateral sinus thrombophlebitis. So let me write the definition for you. It's called otitic because the causative factor is middle ear infection. Raised intracranial pressure without, please remember, hydrocephalus might indicate something else, but otitic hydrocephalus, there is no enlargement or dilatation of ventricles. It is usually secondary to lateral sinus thrombophlebitis. It is a complication of suppurative otitis media. So in this condition, when you examine the cerebrospinal fluid, the fluid is completely normal, only the pressure is high. So we have already learnt about lateral sinus thrombophlebitis. What's happening? A thrombus is formed and that is extending also. So when the thrombus extends from the lateral sinus to the sagittal sinus and impedes the CSF reabsorption by the Pacchionian bodies, then this condition will occur. What are Pacchionian bodies? They allow the drainage of CSF from the subarachnoid space into the venous system. So when they are obstructed, then this will occur. The CSF pressure raises. Now this is a very rare complication that occurs, and even if it occurs, spontaneous recovery is also seen in a few cases. But the mechanism and the pathogenesis, it's interesting. So let us see in detail what's happening. So first there is middle ear infection. This has undergone complications, and now there is lateral sinus thrombophlebitis. This thrombus from the lateral sinus, the thrombus is moving into sigmoid sinus. When the thrombus is in sigmoid sinus, the sigmoid sinus is continuing as the internal jugular vein, right? So when there is thrombus in the sigmoid sinus, what exactly is happening? There are two factors. Number one is, as the sigmoid sinus continues as internal jugular vein, an obstruction here will raise the pressure there also. There is obstruction to venous return. When there is obstruction to the venous return, the pressure rises. Second causative factor is, or second mechanism that occurs is, this thrombus is extending into the superior sagittal sinus and that continues as the right sigmoid sinus, and this will impede the functioning of the arachnoid villi which are present there. Arachnoid villi function is impeded by this thrombus. What is the role of arachnoid villi? They absorb the CSF, And when their function is blocked, when they are not able to do their function, there is no resorption of CSF. CSF resorption is impaired. And when CSF resorption is impaired, automatically there will be raise in the intracranial tension. Intracranial pressure is raised. The venous return is obstructed on one side, and on the second side, the arachnoid villi are also not able to function properly because of the thrombus. And of course, the pachyonian bodies are also not able to function properly. And finally, the CSF pressure raises. There is raised intracranial tension. Now, let us see how this impacts clinically. What are the clinical features? By now, all of you have become experts in telling about the signs and symptoms of raised intracranial pressure. What happens here? The only thing is there is raised intracranial tension. And what will happen because of that? There is severe headache. Sometimes intermittent headache also. And there could be nausea and vomiting also because of the severity of headache. It is that severe. Then there is double vision, diplopia. Why diplopia? Because the lateral rectus muscle that is supplied by the 6th cranial nerve is paralyzed. Paralysis of lateral rectus muscle. Then there is blurring of vision. Because of papilledema or because of optic atrophy. These are the symptoms. On examination, what will you see? Papilledema, swelling of the optic disc will be there because of raised intracranial tension. Sometimes there can be patches of exudates and hemorrhages also, and then nystagmus can also accompany because of the raised intracranial pressure. These are the clinical features. Now let us look into the investigations. How do we diagnose this condition? MRI. Straight away, MRI is your answer, because MRI will allow better visualization of the venous sinuses. When you do an MRI and if there is thrombus, you can nicely see the enhancement in the sinus. How will you see it as enhancement? Whichever sinus is involved, right or left, lateral sinus, sigmoid sinus, that is clearly enhanced and you can appreciate it. Next investigation is a lumbar puncture. What will you observe? I told you the CSF is already normal, but the CSF pressure, if you measure, it's very, very high. CSF pressure is high. What is the normal CSF pressure? Around 70 to 120 mm of water. Here it is approximately 300. It's that high, 3 times raised approximately. Other features like your protein content, sugar content, number of cells, everything else is normal. It's even bacteriologically sterile. This is about lumbar puncture, but please remember, just like I've been telling in the previous videos also, please do lumbar puncture with caution. Otherwise, what can happen? Herniation of the cerebellar tonsil. Next, let's move on to the treatment part. What is your aim of treatment? To reduce the CSF pressure. Why do you want to reduce the CSF pressure? Of course, that is the main complaint, the main problem. But what you are clinically trying to avoid is, you are trying to prevent optic atrophy and blindness, which can occur because of raised CSF pressure. That's your aim. So, medical treatment consists of, what can you do to reduce the CSF pressure medically? Corticosteroids, dexamethasone can be given, mannitol, diuretics like acetazolamide can be used. Dexa, mannitol, acetazolamide. All of them help in reducing the intracranial tension. when there is middle ear infection, of course that is the root cause, right? We also have to prescribe antibiotics for the middle ear infection. Then coming to surgical treatment, here also the aim is to reduce the CSF pressure. So how can we reduce the CSF pressure? Repeated lumbar punctures can be done, or you can place a lumbar drain so that it's periodically drained out and the pressure comes down. Or sometimes a lumboperitoneal shunt is created where the CSF drains into the peritoneal cavity. And if there is any compression of the sigmoid sinus, decompressing the sinus is important. I'll write this down for you. Apart from lumbar puncture or lumboperitoneal shunt, it's important that you decompress the sigmoid sinus. And our goal was to prevent optic atrophy and blindness, right? So optic sheath decompression can also be done. Optic sheath decompression. And for the ear, mastoidectomy. To solve the root cause. After all this is stabilized, to manage the sinus thrombosis, mastoidectomy has to be done. So this is about otitic hydrocephalus. It's a pretty simple topic. It's usually a complication of the lateral sinus thrombophlebitis because the thrombus is extending continuously from the transverse sinus. It goes into the sigmoid sinus and into the internal jugular veins also. What's happening is there is a rise in intracranial tension without enlargement of ventricles. Please remember, otitic hydrocephalus, there is no enlargement of ventricles. Let's quickly revise. There is raised intracranial pressure, no enlargement of ventricles. It's secondary to lateral sinus thrombophlebitis and it is a complication of suppurative otitis media. Once there is middle ear infection, lateral sinus thrombophlebitis, and a thrombus is sitting there in the sigmoid sinus, there is obstruction to the venous return and even the arachnoid villi are not able to function properly. This will lead to impaired CSF resorption. So there is raised CSF pressure. And what are the clinical features because of the raised CSF pressure? There is severe headache, diplopia, blurring of vision, nystagmus and papilledema, classically papilledema. What are the investigations? What do you see on MRI? You see enhancement of the involved sinus. If you do a lumbar puncture, you will see that the CSF pressure is massively raised. What is the goal of treatment? To reduce the CSF pressure. Medically, we go for corticosteroids or diuretic drugs and we treat the infection by antibiotics. Surgically, what do? We try to do lumbar puncture or put a drain so that the pressure is reduced. We can also go for a lumboperitoneal shunt, and decompression of sigmoid sinus, decompression of the optic nerve sheath is also important. And for the ear part, mastoidectomy is the surgery of choice. So with this, I complete all the complications of otitis media. There have been a series of videos, but they're very, very important to you clinically as well as from the exam point of view. Please keep revising them periodically. Thank you very much.